Welcome to the course on body mechanics. In this course, you will learn proper and improper body mechanics for basic lifting, and you will see a variety of specific transfers that are commonly done in long-term care healthcare settings, including the use of specific equipment that can help to reduce the risk of injuries. The importance of safe patient handling goes hand in hand with back safety. It cannot be understated that back injuries are one of the most prevalent types of injuries that can be experienced at work. Healthcare workers are injured at a higher rate than construction workers. Back injuries are not only painful and can be long-lasting, but they're very costly as well, as the individual has to take time off work, attain pain medications, and possibly attend physical therapy for recovery. Whether you garden, play a sport, work in a labor-intensive job, provide childcare at home, or even have a desk job with long hours of sitting, it is nearly inevitable that everyone will experience back pain at some point in their lives. According to the NIH, the prevalence of herniated discs is about 5 to 20 cases per 100 adults each year, and it increases in the third to fifth decade of life with a male to female ratio of 2 to 1. 65 million Americans report a recent episode of back pain, and 16 million have chronic back pain. Despite this, there are still many things we can do at work and at home to reduce our risks. Engaging in a healthy lifestyle will go a long way in reducing the risk of back pain. Exercise is important at all ages and medical conditions as it keeps your back muscles strong, helps your spine and joints stay healthy. Weight loss helps to reduce pressure on joints and cartilage, minimizing the risk of spinal injuries. Third, smoking damages arteries, which in turn affects circulation to your spine, leading to pain and higher risk of injury. Fourth, being mindful of your posture, whether at work, driving, or at home, in motion and at rest, will greatly help. Before you start a lift, plan it out. Don't rush. Turn and face the object you want to lift. Have a shoulder width base of support, bend at the knees, tighten your abdominal muscles, and use your leg muscles to rise. Make sure to hold the object close to your body. If the object is too heavy, get help. This video demonstrates improper lifting techniques. This person is bending at the waist and is reaching too far away from their body, placing them at a higher risk of injury. Instead of using their legs to rise, they are using their back. This video demonstrates a proper lifting technique. The person squats down close to the object and, when rising, uses their legs while keeping the object close to their body and their back straight. Three common injury risks for caregivers include pulling a person who is reclined or supine in bed into a sitting position, transferring a patient or resident to or from a bed to a wheelchair, and leaning over a person for a long duration of time during caregiving. We will now look at lifting techniques for caregivers of patients and residents with video demonstrations of specific transfers, as well as caregiving tasks that require good body mechanics to avoid injury. To help reposition a patient to the head of the bed, make sure the patient can help during this process. If they cannot, get a second person to assist you. Raise the bed so that it reaches your hips to prevent bending forward and injuring your back. Then raise the foot of the bed to its highest position so you can use gravity to shift them up. Holding the sheets, lift and pull the patient towards the head of the bed. If the patient can help, have them reach for the bed rails and use their legs. To help a resident with changing their sheets, ask them to help you by pulling on the bed rail to the direction you want them to turn and bending their opposite knee. While you're changing the sheets, have them hold that position while holding onto the bed rail. Keep in mind, if the resident cannot assist with any of these steps, call for help, as the resident may risk a fall. When completing one side, then turn the patient to midline, then repeat the process to the opposite side. In performing bed mobility, supine to sit, have the patient do as much as they can, including moving their legs to the edge of the bed and using the bed rail if it's available. To avoid injury, you should keep your back straight as you assist in turning them to sit up. In performing bed mobility, sit to supine, have the patient do as much as they can for themselves. If they need greater than moderate assist, including moving their legs, cradle their legs under one arm and reach behind their back with your other arm while keeping your back straight. Once supine, ask the patient to help in repositioning to comfort. In helping a person do a sit to stand, use a gait belt placed at their waist height and fastened snugly. Have the patient scoot themselves forward until the edge of the bed is halfway up their thigh and their feet are flat on the floor. Instruct them to push with both hands from the bed while leaning forward. Keep your back straight and use their weight as momentum to move forward. Please note, if a person cannot stay standing and their knees are buckling or they resist you, help them to sit down and call for help for a two-person transfer. In helping a patient to sit down from standing, instruct them to reach for the bed while bending their knees, and you are keeping your back straight and crouching to avoid injury. In helping a person to do a scoot transfer from the bed to the wheelchair, remove the armrest of the wheelchair that is closest to the patient. Then bring the wheelchair close to the patient. Lock the brakes and position the wheelchair so that it's as close to the patient and the bed as possible to reduce surface gaps. In doing this transfer, you will use gravity by raising the height of the bed so that the mattress is higher than the wheelchair seat. Instruct the patient to gradually scoot themselves to the wheelchair while you help them weight shift as needed. Patient can do this transfer in multiple small scoots. To help a patient perform a scoot transfer from the wheelchair to the bed, lower the height of the bed so that it's lower than the height of the wheelchair seat. Make sure that the armrest closest to the bed is removed. Instruct the patient to place their hand on the mattress. Then instruct the patient to slowly perform small scoots towards the mattress. Hold on to the patient's gait belt while keeping your back straight to prevent injury. To help a patient perform a squat pivot transfer from the bed to the wheelchair, make sure the height of the bed is slightly higher than the height of the wheelchair seat and that the armrest closest to the bed is removed for patient clearance. Instruct the patient to scoot forward and have their hand closest to the wheelchair reach to the armrest. While keeping your back straight, hold on to the gait belt and instruct them to push up from the bed. Perform one single move from the bed to the wheelchair. To help a patient squat pivot transfer from the wheelchair to the bed, make sure the armrest on the wheelchair closest to the bed is removed and lower the height of the bed so it's lower than the height of the wheelchair. Get the patient close to the bed rail and lock the brakes on the wheelchair. Instruct the patient to reach with the hand closest to the bed rail, and the opposite hand to push up on the armrest. Hold onto the gait belt while keeping your back straight and perform one single move. To help a patient perform a stand pivot transfer without an assistive device, make sure the patient can follow instructions and know what their weight-bearing status is. Raise the height of the bed so their hips are higher than their knees. Instruct them to push up from the bed to stand while leaning forward. Using the gait belt, use forward momentum to help them stand. Have the patient safely step towards the wheelchair and have them reach for the armrests while the back of their legs touch the wheelchair. Keep your back straight when helping to lower the patient onto the seat. To help a patient perform a stand pivot transfer without an assistive device from the wheelchair to the bed, make sure the patient can follow instructions and know what their weight-bearing status is. Lower the height of the bed to be even to or lower than the height of the wheelchair. Instruct them to push up from the armrest to stand while leaning forward. Using the gait belt, use forward momentum to help them stand. Have them safely step towards the bed and reach for the mattress and or the bed rail while the back of their legs touch the bed. Instruct them to squat while keeping your back straight when lowering the patient to the bed. For toilet transfers, ensure the wheelchair is close to the toilet and instruct the patient where they will reach to place their hands. Make sure the patient is able to follow instructions. Ask patient to scoot to the edge of the chair, then grabbing the gait belt, have them stand up and reach for the grab bars and slowly pivot towards the toilet. Slowly lower them to the seat while keeping your back straight. To help a patient get up from the toilet and transfer to the wheelchair, instruct them where to place their hands, then reach for their grab belt while keeping your back straight. Have them stand up and slowly pivot towards the chair. Instruct them to reach for the wheelchair armrests one hand at a time. Slowly lower them into the seat while squatting and keeping your back straight. When ready to help a patient perform a shower transfer, instruct them to push up from the wheelchair armrest while holding onto the gait belt. When standing, instruct them in reaching for the grab bars and or shower chair armrests. Talk them through the foot and hand placement for better coordination and safety. It's important when helping a patient with a shower transfer to make use of the grab bars and shower chair as much as possible. Plan ahead the transfer to identify how you and your patient will move safely within the confined space. To help a patient transfer out of the shower, plan ahead the transfer and identify how you and your patient will move safely in the confined space. Guide them through foot and hand placement, including the use of the grab bars. Using the gait belt, help them to stand and guide them through turning safely, as well as stepping out of the shower threshold. When near the wheelchair, instruct them in reaching for the armrests and lower them with your back straight. To help a patient stand and walk with their walker, ensure the wheelchair brakes are locked. Instruct them to lock their brakes if they can. Then instruct them to scoot forward in the seat. Instruct them to place both hands on the wheelchair armrests. Help them stand up by weight shifting forward and instruct them to push up on the armrests while you are holding onto their gait belt. Once they're standing up, the patient can reach the walker handles. If a patient starts to fall when you're with them, safety is dependent on many factors, including if the patient maintains consciousness, if they can follow directions, and if you're alone when walking with them. Before walking with a patient, know their weight-bearing status, what their recent history of walking is, and if they can communicate if they are falling. In this scenario, the patient remains conscious and communicates that she is falling, which allows the staff member time to react. As the patient begins descending, position yourself behind them and hold the gait belt and or the patient's hips. Bend one leg and place it between the resident's legs. Guide them to sit on your bent leg. If you and the resident can stay in this position safely, call for assistance. If you cannot, guide the resident down to the ground while keeping your back straight. In this scenario, the patient maintains consciousness and is still able to communicate that they're falling down. However, the patient cannot remain on your knee and must be lowered to the ground. Bring them down to their knees and then gently bring them down to the ground. If the patient loses consciousness, practice this same technique, lowering them onto your knee and then slowly lowering them onto their knees. Once you and the patient are stable on the ground, call for help. To help a resident with a Hoyer transfer from the bed to the wheelchair, always perform this task with a second staff member to assist. Explain to the resident what will be happening to reduce their anxiety. When ready, attach the 4 color-coded straps to the Hoyer lift to match both sides. When you're ready to raise the resident, make sure their hands are resting on their stomach or their lap. If the patient has a paralyzed arm, be extra mindful that the arm needs to be safely held in place so it does not fall to the side and risk an injury to the shoulder or their arm. If possible, the patient can hold their paralyzed arm with their other arm. One staff member will control and move the Hoyer lift device, and the other staff member will help with the patient's feet and positioning the patient to guide them to sit in the wheelchair safely. As mentioned before, it's imperative for 2 staff members to help in this process to prevent unnecessary pulling or pushing of the resident and the Hoyer lift, which can create an injury for the resident and for yourself. To use a sit-to-stand lift machine for transfers, the patient must be able to bear weight on both legs. To help a patient to transfer using the sit-to-stand lift, also called the standing lift machine, position the patient to sit at the edge of the bed. Explain to the resident how the transfer will work. When ready, place the transfer pad behind the patient so the straps wrap around their waist and under their arms. Clip the belt ends together and tighten them so they're snug on the patient. Then bring the machine towards the patient and help them place their feet onto the foot pad. Lock the brakes of the machine, then attach the color-coded straps to the machine on both sides. Instruct the resident to hold the side lift bars during the transfer. When ready, using the lift controls, raise the resident and ensure that their knees are pressing into the knee pads. When the resident's bottom clears the bed, unlock the brakes of the machine and then guide the machine to the wheelchair or the toilet. Lock the brakes again and lower the patient into the seat using the controls. Once the patient is safely sitting, remove the straps from the machine, unlock the lift brakes, and then remove the machine and the transfer pad.